Hi, my name is Piyush, and in this poster, I'm going to discuss about the National Safety and Quality Health Service Standard 8, that is recognizing and responding to acute deterioration standard. This is about Mr. X, who is a 70-year-old man who underwent coronary bypass surgery and had a medical history of ischemic heart disease, hypertension, atrial fibrillation, and COPD. He was on fluid balance chart and had an IDC in situ. His condition was initially stable, but suddenly he started experiencing shortness of breath, and his GCS dropped to 14. Further, there was like a significant change in his vital signs. His blood pressure dropped down to 85 over 40. Heart rate was around about 130. SATs were sitting at 90% on room air. Respirator rate was 23, and the temperature was around 37.5. So when asked about, he was experiencing pain 5 out of 10. As his blood pressure was in the med call criteria, nurse in charge was informed immediately, and med call was initiated. After that, after reviewing and following organization protocol, a medical team commenced him on continuous IV fluids. He was After that he was put on 2 liters of oxygen via nasal prongs, and ECG was also done on him, and his blood pressures were also taken. Following organization policy, his vitals were reassessed for every 15 minutes, as you do, for 1 hour, and then half hourly for 2 hours, and then hourly for 4 hours, and then his FVC was also continuously monitored. Finally, after a while, his vitals came back to normal, with blood pressure ranging from 105 to 110 over 50. Heart rate was about 105 to 107, which was still better than what it was before, and GCS was around 15 again. But the thing was, there was no analgesia that was available for the patient due to schedule conflict. So the doctor had reviewed some pain medication for the patient, and it was given to the patient as prescribed by the team. During this whole scenario, the whole team tried to work under like the organization policy and follow the NSQHS safety standard to maintain the best practice for this standard. It is important to maintain clinical governance and work under um, organization policy, and I think it is very important to ensure that these policies are implemented properly, and all healthcare professionals are very well trained to recognize and respond to the changing patient's condition. Because, as we know, it is really important to react to how your patient is responding. So during this whole scenario, I have observed that all the healthcare professionals involved with Mr. X's case has always maintained the scope of practice and worked under the policy of organization. Further, under this standard, every organization must set up a criterion for detecting any abnormalities in patient condition. Also, due to these physiological and psychological abnormalities, organization protocols must specify what steps should be taken for escalating patient care. Likewise, in this scenario, the best practice is maintained as healthcare team had recognized the drop in patient's blood pressure and initiated the med call as per the protocol for hypertension. Another important action to maintain the high quality practice, it is primarily important that after recognition of deterioration in the patient's condition, healthcare professional appropriately responds to it as per organization guidelines. Likely in this scenario, following the protocol, Mr. X was commenced on IV fluids. As I said before, his blood culture was taken, his ECG was completed, and all the other assessments were also done. I consider that during this scenario, most of the things were done in a very efficient manner. However, some of the improvements can be done. Obviously, like in every scenario, like I found that although the team had worked in although the team had worked in very efficient manner to support the patient care. However, I think there was like a clarity of the team leader because of the multidisciplinary team which was involved during the med call. Further reviewing various researches, I found that it is very important that specific roles must be specified during an emergency. Like you have to give everyone their roles and they should know what they're doing. Additionally, a clear leader is very important during the emergency, like a med call, as the new nurses might not have that sort of experience to deal with a deteriorating patient. I consider that sometimes during emergency, some like healthcare professionals do stress, and due to stress, they didn't follow an ISBAR handover format, which might lead to missing information for patient and can lead to like communication gap and in a multidisciplinary team. So all healthcare professionals must be appropriately trained to work under a situation like that, and must have the capability to recognize and respond to the patient deterioration. Thank you very much.